Okay.
Get your butt out of here.
All right. There
That
she
bitch has been
goes.
waiting.
Who, Kitty?
You have food.
I'm adding you, Kim. Does she have food in her bowl? Okay, it's adding you. Come on. Don't do this to me. Sometimes it won't even add. I would have to. There she goes. Yay!
There. Yay!
You did it.
I
Awesome. How are you?
good. How are you?
I'm good. I'm good.
Good.
Feeling much better, thank God. How are you doing? How's
I'm doing
everything over there in
great.
Canada?
It's a little cold tonight. I
Is it
know.
really?
It's actually cool compared to the weather we had last week. It was pretty warm. So I've got a
So what's
sweater
the
on.
wow? So how cool is it out there? Now remember, I'm Fahrenheit, so you got to tell me
It's
Fahrenheit.
it's about 68 degrees, I think. Maybe
Oh,
68
that
or
is chilly.
70. It's chilly for me
Yeah,
even.
yeah,
So,
yeah,
yeah.
yeah. That
Yeah.
is chilly. Yeah, out
So,
here it was out here was in the high 80s, so it was good.
oh
It
wow.
was good.
I like it when it's that hot, but it
Yeah.
doesn't it's a couple of weeks in the summer and then it goes away and then it's cold again.
Oh wow. Well, yeah, you're up north. I know that sucks. I love the heat. So we got Bonnie watching and Becky. Hey, Becky. She says, how are you feeling? I'm feeling much better. Thank you. We got Tony. Hey, Julie. So yes, I'm feeling much better. Thank God. I was this week and last week at doctor's offices, but I'm feeling much better. So thank you for
That's good.
asking.
That's good.
Yeah, that's why I couldn't go to the Elk Summit in Atlanta, Georgia, because I came back from DC sick.
Yeah.
So yeah, ended up in the ER and everything. So, but I'm good now. I'm good. I still have a little cough, but I'm good.
That's good.
Yeah. So yeah, we got some viewers. So thank you guys for watching and for tuning in. Before I get started and introduce you guys to Kim, please tag people, share the video. Let's get some more viewers out there. Um, it's great when other people tune in, even though they're not lung cancer survivors, but it's good for anyone and everyone to hear these stories and to learn and get educated about lung cancer. Because that's why I do these every Thursday at 8 o'clock my time. So I'm going to introduce you guys to Kim. Kim is a lung cancer sister. She is from the country Canada. Woo!
Woo!
I love
Woo!
Canada. It's cold, but I
It's
do love
cold.
Canada. Yeah. So I love Canada. I love my Canadian sisters. I know I got a few. Hopefully they're watching. So make sure you guys share it as well, and or tag people so they know to come in and watch this. So Kim, I met you at one of the Hope Summit, correct?
Yes, I did. I met you at the Hope
Okay.
Summit in Washington in April.
Okay. In April. Okay. But prior to that, we were Facebook friends, right?
Yes, yes.
Yes.
Did you
Okay.
did you did
So
you go to the Worlds in Toronto?
yes.
I met you at the Worlds in
Okay.
Toronto in
Okay.
September.
That's
Yeah,
right. Okay. So we met at one of them.
yeah.
So when I went to Canada in September, I went to the World Lung Cancer Conference, and so I got to see some of my Canadian sister. And you're right, I think that's where we met, and then we saw each other again in DC
Yes.
in April. Okay, so that's how we met. But prior to that, I think we were Facebook friends. So
Mm-hmm.
we have I have a lot of lung cancer sisters and brothers that are my friends on Facebook, and I haven't met them, but someday I'll meet them, or I have met them already. So, but it's just that we have that connection, so we just become Facebook friends. So Kim is a lung cancer survivor, stage 4, correct?
Stage 4. Yes.
Yes. So, and what's your mutation?
I actually am an EGRF resistor, so I'm
Okay.
on my second line treatment.
Okay,
So
so she's also, which I know a lot of you guys heard stories from other lung cancer sisters that are EGFR. So she's one of them. But I am going to give it away to Kim. Kim is going to share her story living with lung cancer. Um, and whatever else that she feels that she wants to share with you guys. If she does advocacy work, and everyone has some type of like me, I just share lung cancer videos, and I do a lot of advocacy work. And now I really like that I was able to go up to the Hill in DC and, kind of demand for more funding. So that's legislative here in the States. I don't know how Canadians do it different. If she does that, she'll share what they do in Canada. Because like I said, she's going to share her story and what they do in Canada. Where me, I do more of the States. But hey, if I get the opportunity to go to Canada and speak, I sure will. Hey, I'll help my Canadian
Absolutely.
family. Yes, I will help them out. So, with that being said, I'm going to give it to Kim. So, Kim, go ahead and take it away, sweetheart.
Okay, so I am a lung cancer survivor. I was diagnosed in February of 2017. Basically, I have gastric reflux, and I felt I had a cough that didn't disappear after changing medications several times. So I actually advocated for myself and asked the physician to order me a chest X-ray because I thought maybe I was getting pneumonia. You know, when you have asthma and you feel congested and stuff.
Yes.
And so she ordered a chest X-ray for me, and I said, I'll do it first, and I'll come and see you next week. I promise. And she called me at the end of the day, and she said, I think you need to have a CT done. So you knew something was up right away, because actually the first
Right.
thing they asked me at the X-ray was if I were a smoker.
Hmm.
So I
There's
thought,
that stigma.
there goes the stigma. There's something going on here. So I had a CT scan done the very next day, in Canada, there's a little bit of a wait time for testing. You usually can't get in and get a CT within 24 hours. It might take a week or two.
Hmm.
So, oh, dog.
Yes, my dog.
So
I'm sorry about that. He's going to bark. I can't shut him up. He's a barker.
I,
Steve, can you shut that dog up? I'm telling you, my husband has shut him up.
I'll get my Siamese
So,
cat after him.
there you go. Chemo, be quiet. Oh my God. Yeah. He's loud too.
Yeah, it's
Chemo,
funny.
come here. Maybe if he sits on my lap, he'll shut up. And I told my husband I'm going live. Shut that dog up, and he doesn't.
Of course.
So of course not. So as long as they could hear you, that's all good. So go
Okay.
ahead.
Okay. So from there, I had a CT done, and basically, I went through the weekend on antibiotics because she thought, I'll put you on antibiotics anyway, just because, and it just made me sicker. And on the Tuesday, she said, you have
Oh.
a tumor that is 5 by 7 centimeters in your right and your left upper lobe with spots in the lining. So
Ooh.
no, hardly any symptoms.
Mm-hmm.
So she referred me to the Ottawa Cancer Clinic, and from there I was referred to actually a thoracic surgeon. I didn't really
Okay.
realize it at the time. I thought it was an oncologist, but it was actually a
Mm-hmm.
thoracic surgeon. So I was referred to a physician there who explained, the tumor the size of a Kinder egg, which I fondly call it a Kinder egg because I don't really like Kinder eggs. So
Uh-huh.
it's a chocolate in Canada that we can't bring to the States that's banned. So because of the little plastic things in them. And
Okay.
so I met with the surgeon, and basically said, because you have spots in the lining, it makes it stage 4. It's not removable. So what you need to do is he said that he would do biopsies to test for biomarkers. And
Okay.
at that point, 3 weeks later, when he did do the biopsies, he needed to put in what they call a pleurix tube. So it's like a chest tube, but it's a tiny,
Mm-hmm.
tiny chest tube that they put in
Mm-hmm.
into the lining. When he did do the biopsies, he actually took 3 liters of fluid off, which
Oh,
is a lot of fluid. He said
that's a
basically,
lot.
that's a lot. It's 8 pounds of fluid. So he took that
Wow.
off. And the lung actually healed really well, because usually once they take the fluid out of the lung, it doesn't come back. And they hope that your lung is going to adhere to your lining afterwards. So that worked. When he came back with the results, my oncologist said I had the biomarker, I had the exon 19 mutation. So we started on
Mm-hmm.
afatinib right away. I took afatinib for the 11 months. I had a lot of difficulties with the afatinib, though. I started at the high dose, and I had to have it reduced a couple of times
Mm-hmm.
with a drug holiday in between because I was extremely sick on the medications. And after I took, He told me to take 4 days holiday off the drug. The last dose, I actually took 4 weeks off. And then I went back on the medication and I was able to tolerate. And I took it for in total for 11 months. But then the lining started to thicken again, right? Which is progression. And so we did the liquid biopsy this time for the T790, and it showed up. And I've been on the Targresso since
Okay.
February of last year. I've been on it 18 months now.
Okay, good. And it's working
Yeah.
well for you?
I have a couple of nodules that have showed up on the last CT. We're not
Okay.
100% sure that they're metastases, but they are going to do some CBRT in September on them.
Okay.
One is
Okay.
6 millimeters and one's 8. They're just tiny, so
Okay.
they're gonna zap them. So
Okay. So that's good.
yeah,
Now,
yeah.
you said that you were stage 4. Was it stage 4 because the size of the tumor, or was it stage 4 well because of that and because you had nodules? I mean, did you have any in your lymph nodes? I'm just trying to understand why stage 4.
Because what happens is with the lung, because I had a tumor in the lung, when you have spots
Okay.
on the lining, it's considered metastasized to the lining. And the lining of your lung is not removable. And basically, like the doctor
Okay.
described it as like if you drop a hamburger in the sand, he says, though the tumor is here and I could take the tumor out, from here to the spots in the lining, it would be all through. So he says it's kind of like
Okay.
sand on a hamburger. You can't get rid of it all,
You
right?
can. Okay.
So, and
Okay.
because the
Well,
lining's
that
not
makes sense.
removable. Yeah, yeah. So that
Yeah,
makes it
that makes
stage
sense.
4.
Okay.
Yeah.
Yeah, and you
I,
learn something new every day. When I do these interviews, I ask questions because I don't know everything. But when you said and then
exactly.
you know what? And you're the first that I think that I've interviewed or talked to that had cancer in the lining. I don't think, I'm almost certain I haven't heard anyone having cancer in the lining. So like I said, I learned something new. You learn something new every day. So doing these interviews, that's why I love doing these interviews, because I learn and other people know, because I'm pretty sure I'm not the only one. I mean, there's probably other lung cancer sisters or brothers. I'm like, oh,
Yeah.
I didn't know that. And you don't, but it's just so, you know, important, for me to do this, to educate people. So that's, yeah.
Exactly. Because every
Wow.
every every case scenario is now I did not
Yes.
have metastases anywhere else but in the lining of the lung. So that's what
Okay.
made
Oh,
it
that's
stage
interesting.
4, which was
Right.
interesting. Yeah. So
Yes, very interesting.
and nothing in the right lung. It was just all located in the
All in
left
the
lung.
left.
Yeah.
Okay.
So
Okay. And then I also know that when they say that when they find lung cancer on the left, it's kind of like dangerous or something because it's close to the heart or something like that. It's by the heart.
yeah, because the
Yeah.
heart sits farther over.
Yeah, and it's just like I always heard that, and it's like when they're always on the left side. I don't know why I think about that. I'm like, oh, so how's your heart? I mean, is your heart okay? Because I know some people will get radiation, but I just think that you get radiation is just everywhere. They say like mine was on my right side, honey. I know my heart got some radiation, so and that's why
Yeah.
I see a cardiologist. Um, I go see a cardiologist and they monitor my heart and they do echocardiogram and all that stuff because they want to make sure
Make sure.
from the
Yeah.
chemo and radiation, they want to make sure that my heart is still, but so far
Strong.
so good. So yeah, it's good.
That's
I do
awesome.
have a higher heart rate, so they put me on some pills called metoprolol, so they keep my heart
Just
rate
to
low.
lower it. Yeah.
Yes, because it
Yeah.
was over 100. And
Yeah.
it's like they kind of figured it has to be from, the past, the chemo and the radiation. It has so they I said, look, just give me some pills, so I'll take it. So my heart rate is good now. So
That's
yeah, everyone
excellent.
is different.
Yeah.
Everyone's
Yeah.
different. Wow, wow. That's very interesting. Very interesting. But you're doing great on your Tagrisso, right?
I'm on Tagrisso, full
Yeah, and
dose,
you're doing
full
good.
dose.
Yes, full
So
dose. Okay. Yeah, and I
yeah.
know there's quite a lung cancer sisters that are on Tagrisso, and everyone has different side effects, but they're doing great. They're doing great on it. I heard it's great for EGFR, so I am so glad that it's working for you. Do you have any bad side effects or any side effects from Tagrisso?
The afatinib that I took, the first one, was really hard
That
on the
one's really
system.
bad. Yeah.
Everybody, I know everybody, because it's panicky how you take it 3 hours before, an hour after. You have to be careful
Yeah.
about the food thing. and it does cause a lot of diarrhea. And for me, it did nausea, vomiting, and diarrhea. So it ended
Oh,
up pushing me in and out of the ER about 6 times until I
yeah,
reduced the dose. The Targresso, it has a side effect profile like diarrhea and some nausea and joint
right,
pain and muscle spasm, but nothing that's not tolerable. Like you can
right.
get through your day and it doesn't bother you. Diarrhea, you can just take medication like a Lomotil for it or Imodium,
Yeah,
depending on your choice. You know,
right,
the side effects are tolerable and manageable. That you can do things from day to day. You know, and it doesn't really impede anything. So.
right. Oh, well, that's good. That's really good. And so right now you're considered stable, correct? Or are you NED? No evidence of disease.
I was Ned up until those two nodules showed up on the last
Okay,
CT scan, right? I had had
okay.
several scans that were clear, but then those two nodules showed up. So, but it's a little precarious with that because I tend to obtain my results before I go to the
Yeah.
doctor. I get them online, and I'm a nurse by trade. So the one that
Uh-huh.
showed up in July showed these two nodules, but the CT before that showed nothing. And when they
Mm-hmm.
compared the July CT to a January CT, they said, "Oh, we saw it in January at 2 millimeters." So I think even the radiation oncologist is a little baffled by the
Mm-hmm.
fact that the CT in between showed nothing. So she's actually going to do another one next week and do the tattooing for radiation.
Okay.
But I'm not doing radiation till after Barcelona. So
Yes,
I'm going to Barcelona in
yes,
September to the
yes.
World Lung
Y-
Conference. So
Yes, you were chosen for the STARS program, correct?
yeah, yes, yes.
Congratulations.
Thank
Yes,
you.
that's awesome. Yeah, I was trying to go out there. I didn't get selected for the STARS program, so there's no way I could afford Barcelona right now. If a miracle happens, I win the lotto or the lottery, then maybe I could go. I don't know if God drops some money down, then maybe I could go. But I could go by myself with Ivy and Jill, but my husband won't let me. He goes, "You are not going to Spain without me." And he won't let me go. He's like, "You are not going without me." And so Ivy's like, "Oh, just let her go with us." He's like, "No." So I can't go. I mean, I could go
Yeah.
because all I have to do is buy the plane ticket, and then I could stay in one of their rooms
Or
because
you
they're
can stay
going.
with me. You could stay with me.
Exactly. Exactly. I could stay with you, but then Jill and Ivy are going to stay longer. So then I could split the room with them. So it'll be much cheaper. So
Yeah.
yes, I could basically afford to go if it was just me and then spending money while I just have to really, eat something out of the appetizers or something but he won't let me go.
Just
I
like in
really,
Toronto. Just like in
I,
Toronto when they
I
had the
know.
apps.
And exactly, exactly. And I really would love to go, but he won't let me. He goes, "You're not going
Yeah.
to Barcelona without me." So I can't go. Like I said, unless a miracle happens,
Yeah.
I could afford it for both
Yeah.
of us to go, and then we'll go and
Yeah.
stay longer too to tour. But yeah, there's
I,
no way. So, but congratulations on
thank
that.
you.
That's
Thank you.
amazing. That's amazing.
Yeah. My,
So no,
go.
go ahead. I'm sorry.
No, you go. You go.
No, I was just going to say if you could talk a little bit more about your advocacy work that you do in Canada. And I know Jill from Canada, and I think Cecilia just
It's just,
commented, and
oh,
I know Heather's out there, and Marianne, and God, there's just so many. I'm trying to remember everyone from Canada. But if you could talk about your advocacy work and what you do, and what you guys do in Canada to bring awareness and do what we do here in the States.
yeah. So basically, after the Worlds, that was pivotal for me because at that point I didn't really hadn't been doing any advocacy work. I was just basically,
Hmm.
sort of a patient as opposed to an
Hmm.
advocate. Once I went to the Worlds, it opened everything up. So
Yeah.
from there, I started to go to the Ottawa Circle, the Lung Cancer Support Group, which is the first one in Canada that was founded by Jill Hamer Wilson. And I think Andrea, maybe the two of them had started that group.
Yeah.
So I joined that group, and from there I did my own 30 days of lung cancer on Twitter. I was determined that I was going to join Twitter and put 30 days of lung cancer in the month of
There
November.
you
So that's
go.
kind of started where I started tweeting out information and
Yes.
things that I
Awesome.
felt that were important. I
Okay.
joined Lung Cancer Canada And Marianne and Heather in the Canadian Lung Cancer Advocacy Breathe Hope group. That's sort of the Canadian website on Facebook for us. When I
Okay.
joined, it was small, and because we're kind of getting the word out there, the group has actually grown to 54 members, which is incredible.
Awesome. Yes.
Um, since I started, two girls, two ladies in Winnipeg, Christine and Allison, have started the Winnipeg chapter for Lung Cancer
Okay.
Canada for a support group. So we have a second support
Awesome.
group there, and something has started up. They've done some informal stuff in Calgary too. My friend Janice, who was at the Worlds, was
Yes.
involved with
Uh-huh.
that. So I basically had been doing that and getting involved with the EGRF resistors and the things on Facebooks. The other part that I've been doing on my own is I spent 6 months trying to find out AstraZeneca's link for Targresso in Canada. It's easy to link up with them with the Targresso group in the States, but it took me about 6 months to find. It's called the Targresso Advocacy Group, TAG.
Okay.
So I'm linked
Uh-huh.
up with them now. We're going to do a little bit of promo with my bio and information, and we're linked to a program called The Right to Survive with the Canadian Cancer Survivor Network. So I've been working with them, telling my story and getting the word out. Um, the big thing we did with Lung Cancer Canada this year is that we did the first walk in the Ottawa race
Yes.
weekend. We had the
I
first
saw
lung
that.
cancer team. There
Oh,
was
that's amazing.
that was amazing. So Chris Draft came up. We walked, did the whole 2K, and yeah, so we got the word out, and that was really awesome.
Yes. That's
So
amazing. I saw that. That was so great. I'm so happy for you guys.
yeah,
So happy. That's great to know that there's, I mean, unfortunately we had to meet under these circumstances, but we're family now, and it's like,
absolutely.
you guys are doing great things in Canada, and I couldn't be more happy or more proud of you ladies out there in Canada just doing this amazing work. And I know that a lot of us here from the States, we try to help you guys out or give advice and stuff
Yep.
like that, and that's just great. That is just amazing. Yeah, that's just great. I mean, now you guys might as well start your own like Lung Cancer Canada organization and make it big, like longevity and Go To and all them. I mean,
We're
why not?
hoping. We're hoping. We
Yes, that
we
would be
keep doing
great.
fundraising. So Lung Cancer Canada also has been putting out podcasts too. So I did a
Oh,
podcast with
great.
them. So
Oh,
people.
that's great.
So we're doing podcasts. We're grassroots. We're slow, but we're
Yes,
growing. Like a little
yes,
baby. So we're getting bigger, and our voice is getting stronger, which is great.
that's right. That's right.
So
And you got us crazy Americans to help you. So
absolutely, you guys have been fantastic sisters.
yeah, that's awesome. I'll get so happy to hear.
Yeah.
So Karina Garza Flores she asked, in your cases, I guess you and I, was there a family history of cancer? Okay, so in my side, yes, my father passed away from bile duct cancer. My mom was a two-time cancer survivor, but she passed away from a massive heart attack. My mom had cancer in the voice box. I think it's called larynx cancer.
Okay.
And then she had, it's weird because they usually say that when the cancer comes back is usually from the first source. So let's say, for example, if I have lung cancer, but if they find a tumor in my breast, it's not really breast cancer.
It's
It's
lung
it
cancer.
comes Yes, it's still lung cancer, just one in my breast. But my mom had skin cancer. So
Oh,
I don't yeah, so I don't know if it's skin cancer, skin cancer. So
yeah.
I don't know if it came from her, larynx. I don't know, honestly. Now, um, Karina, lung cancer they say it's not hereditary.
Mm-hmm.
But the more I keep hearing about these gene mutations, and the more I hear where family members, they had a grandparents and parents and aunts, and in them, they said that there was a damaged cell. So if you think about it, if it's a damaged cell, then that's hereditary, because that damaged cell
Gets
is
passed on.
yes. So they're saying it's not hereditary, But when you have like Jill's a perfect example, and
Yeah.
there's a couple other ones that I interviewed that I just interviewed not too long ago. Oh my God, who was it? She was from Detroit. I can't think of her
Debbie?
name.
Debbie?
Debbie,
Debbie.
yes, yes. And Debbie said, that I think her mom or grandma, someone in her family
Yeah.
had lung cancer, right? So if it's a damaged cell, then that's to me that's hereditary. But then again, I don't know. So lung cancer, they're still doing. That's what we need the funding for more research because it's just so complicated. Lung cancer is so complicated. I can't even get in depth with it. But in your case, Kim, is there anyone in your family with cancer?
Like I think I had a cousin who had breast cancer. Nobody in the immediate family had lung cancer. My grandmother, she died very early at 65, and my mom seems to think that perhaps she had had brain cancer. But again, you don't know. Back then, 40
Right,
years ago, it could have been lung cancer and quickly metastasized. So,
right.
but there's no real strong link in my family. Like we were pretty shocked when they said you have lung cancer, like because there's
Yeah,
really going 3 generations back, there's no lung cancer
right,
specifically. So
right.
it was
Okay,
even now, there isn't any family member in my family right now that has cancer or is being treated for cancer. So yeah, it was a
right.
real
Yeah,
one-off in our family.
right. Yeah, so there you have it. It's just lung cancer is complicated. That's why we do this
Yeah,
to educate,
yeah,
to bring awareness, and we do fundraisers. Or like me, I go to the Hill in
yeah,
D.C. to talk to our legislators. My congressman, my senator, to get on board. We need the funding to find out what the hell is causing. And then it's middle-aged non-smoking. That's what gets me. And my husband, he'll say it. He thinks it's in our perfumes or body sprays or our body wash. He thinks that because we all use perfume, I love perfume and body spray. He says that all the time. He goes, I bet you there's something in there. I don't know. He could be right. He could
yeah.
be right. Yeah, Stephanie said both of you are inspiring, strong, courageous women. Thank you, Stephanie, so
Thank you.
much. Okay, so Lori, another lung cancer sister, she goes, Juanita, you can have multiple primary cancers. Really? See, and I was told you couldn't, so you got to give me more information about that. I
Yeah,
was told you couldn't. I was told that it comes from the primary, let's say
the
lung cancer for
primary.
me.
Yeah,
Yeah, that's what I was told, and Kim's agreeing. So, Lori, you got to give me more information on that because, girl, that's news to me. Let me
yeah,
see. I am Jill says that she is the founding member of the Ottawa Support,
yes,
yeah,
yes, yeah.
along with others. The group was started because of a group of oncologists and other members at Ottawa Lung Cancer Community. Awesome. Thank you.
It's
Thank you,
because
Jill, for what
it's
you
because
do.
Jill was the driver of that for
Yeah,
sure.
that's good. Thank you, Jill. Thank you, honey. Um, and then Karina said thank you. Okay, and then Carol Ann said, I have had two primaries. Wow.
Okay.
Breast and lung. Okay, well then that I'm just saying what I was told, and Kim
Yeah.
agreed. We were told.
Yeah.
So primary, okay, well, no wonder my doctor keeps bugging me to go get a mammogram. And I told her, no, I don't need a mammogram. She keeps bugging me to get one. So Carol Ann says she had two primaries, breast and lung.
Okay. I'm gonna have to
Okay, so
ask my
that's
doc about that one too
yeah,
now.
I gotta ask my oncologist. Yeah, thank you, Caroline, for that. And Lori. Lori goes, a friend of mine had colon cancer, and then years later he had prostate cancer, and it was prostate cancer, not colon cancer, in his prostate. Okay, there are carcinogens in perfumes. Yes, they are, Barbara. Yes,
Yes,
they
there
are,
are.
sister.
Yeah.
And you know what? My husband really truly believes that it's women getting it and non-smoking women. He really believes that it's something in perfumes and body wash or body spray, the stuff you buy at what is that,
Yeah.
those, yeah, he believes that. He tells
Yeah.
everyone that till this day. And so ever since he said that, I'm like afraid to put perfume. Yes, you need
Only
a
on special
mammogram.
occasions. Yes.
Yes, it's
Yeah.
very right.
Yeah.
Laurie said, yes, you need a mammogram. It will be a smashing good time.
A
Don't,
squishy.
oh my God, they
So
hurt so bad. I
painful.
hate mammograms.
Oh God.
They hurt. Oh my God. Just thinking about it, they
I've been
hurt.
I've been avoiding it,
Yeah,
honestly.
me too. Me
I,
too.
I'm like,
Okay. So I guess you can. I was just told that it's from the primary that if yeah, I was told that you couldn't, but hey, you learn something new every single day. So thank you for that information, guys. I appreciate that. She goes, Barbara said a lot of things filled with chemicals. Yeah, you're right.
well,
I believe that.
Febreze, they say spray it on your couch, make your couch smell good. That can't be good.
Yeah,
That can't be good, you know?
exactly. I agree. I
So,
agree. All those, who knows?
yeah,
Who knows? But they need to get to the bottom of it. That's, they need to have a special group just to figure out why in the hell middle age,
yeah.
non-smoking women are on the rise of getting lung cancer.
Yeah,
They need to figure that
there's
out. They
there's got
really
to be
do.
an
It's
environmental factor there for sure. Besides
exactly
radon,
right. Besides,
if your
exactly,
kids like room is in the basement or something like mine was, it
exactly.
kind of makes me wonder. But I haven't gone that far. Don't tell my mom.
Yeah.
So
No,
I
but
don't
yeah,
want.
something is something. And let me see. Janice said, I always told my family that cleaning the house was going to kill me. Okay, yeah, yeah. I'm telling you, have the mammogram. If there is a preventative test for early detection, have the test. Okay, okay, Barb and Lori, I'm gonna go.
Yeah,
After I come back from my trip, I'm gonna go. I promise. I
yeah.
promise I'll make the appointment. No, I'm not doing colonoscopy. I hate that. I'm not doing it. I don't care what you say. I'm not doing it. I'm not. I'm not. I don't. That's one. That's one that I want to avoid.
Oh, yeah, yeah. That's no
There
fun.
has to be another test besides
There's,
colonoscopy.
I
I'm not
think
doing
I
it.
think in Canada you can actually do a little smear test and send it in the
Yes,
mail. So
I
I think
think.
I'm going to go that route before I have to have the
Yes,
colonoscopy.
yeah. I think I'm gonna do
So
that too. I'm gonna tell my doctor, give me the smear testing one. I am not doing the colonoscopy yet. Sorry, Barb. I'll do the mammogram, not the
yeah.
colonoscopy. I already poop a lot from my targeted therapy. I'm not trying to poop more.
But
Oh my goodness, I leave that for.
going back to cleaning products, I don't use cleaning products in the house. I use the Norwex cloths or the cloths that with
Yes,
the silver. That's all I use. I don't use
yes,
cleaning products because they're too abrasive, right?
I know.
And you can
I
get them
use,
just as clean with the Norwex with the
yeah, you
silver in
can.
them and everything. So that's what I
Yes.
use. And I have been using them for probably 10 years.
Okay.
So,
Oh yeah, I bought some
yeah.
Norwex. I use it once in a while. I forget. Barb said colonoscopy, best sleep you will ever have. She's so silly.
And when you're sleeping, if you know the nurses like I do, they'll threaten to write on your bum.
Yeah, Norwix is a great product. I have a friend here in the States, here where I live in Indiana. She sells it. So I bought a few and I just forget that I have them to clean. But me, I like to use the products because your house smells so good afterwards. I like to come in and it's like, oh, it smells so good. That's just me. So who knows?
Yeah.
Um, it could be that, and it cannot, we don't know. I just stick with my husband. I used so much perfume when I was growing up. I still have a cabinet full of perfumes. I do. And I use them like I want to smell good, and who knows, who knows. And I still
Yeah.
have them. I use them on special occasions, but
Yeah.
and I'm so
Yeah.
afraid now. I
Yeah.
am. I'm like afraid.
Yeah.
I'm like, oh no, I don't want it to. I mean, who
I'm just
knows?
I just generally more paranoid about all scents, like when you're out and you smell smoke or you smell this or something strong. I always wonder, well,
Yes,
what is that? Like what is it
yes,
doing? If you're breathing it in and it's unpleasant, well,
yes,
what's it really doing to the lungs? So I'm a little
exactly.
after you have lung cancer, I think you get a little more paranoid about certain things or
Everything.
sensitive,
Yes. That's
So
me. We could be outside and someone's smoking. I'll tell them, can you keep walking over there? They're like, well, we're outside. I don't care. I don't want to smell it. I have lung cancer. Go over there. And
yeah,
I do. I make a move. They probably think I'm a crazy bee, but that's okay. But
yeah,
I don't want to smell that.
yeah.
So, yeah.
I totally agree.
Yeah. So Lori says the smear test only picks up blood polyps,
I know.
don't
They want to
necessarily
have a
bleed.
look.
I
They
know.
want to have a look with the camera.
Yeah. I know, Lori.
You'll
I'll do
have
that first.
to.
Okay, let me do that first, okay? And then I'll think about the other one. Let me see. Jillian Kingston said off gassing from furniture, carpets, etc. is also a worry. Yeah.
Yeah, and they stopped
Yeah.
Scotch guarding in Canada. They banned that on
Yeah.
furniture. They stopped the Scotch guarding probably for that reason,
Yeah.
right? It was
Yeah.
carcinogenic. So,
And see, that's what I like about like Canada and other countries. They ban things that are not good for us, not the states, because they're money hungry, they're greedy bastards. You know, they go up there to lobby and this, and they will not get rid of it because it's all about the money here. We're a
yeah,
greedy
yeah,
country.
yeah.
We are. I'm sorry. If people don't like it, oh well. And don't tell me to leave because I was born and raised here, and my ancestors were here before anyone else. So let's not go there because we've been getting a lot of that here in the States lately.
Oh
But
man.
yeah, yeah, it's crazy. But yeah, I mean, I'm just, I don't know.
Yeah.
It's just crazy.
I
Yeah.
hear you.
Let me see. Barb says, my neighbors have a fire pit outside at all the smokes comes in my house and it's terrible. It's unbearable and so unhealthy. I heard about fire pits too.
Yeah.
You know, everyone likes to sit outside around the fire pit and do, marshmallows and make some s'mores but I heard the same thing about that can't be too healthy.
Well, look at the firemen. The incident rate
Oh
is
my
higher in lung
God.
cancer, right? Because they're exposed to more stuff. They're exposed to smoke, right? I've read a lot of articles from the States about that, especially after 9/11. So,
And you know what my fear is? Both my boys are firemen, and that's what they
yeah.
chose, their career.
Oh,
And I worry about that. But I told them that here in my local hospital, which is actually right outside, the emergency room is right there, and they do CT scan low dosage for like you don't have to do it with your insurance. You could just pay. I think it's $49.
yeah.
Well, dollars. So I don't know what that would be in Canadian dollars, but yeah, $49 US dollars. And so and it's a low dosage CT scan. So I told my boys that every year I want
Hmm.
them to go do that
Yeah.
just to be on the safe side. They should be banned. Girl, everything should be banned, but it's not going to be banned here in the States, Barb. The Barb said they should be banned. It's not going to be safe. This is a greedy country. It's all about dollars here. So, and
Yeah.
it's sad. It's sad because if you go everywhere else, a lot of things that should be banned are banned in other countries, but not here.
Yeah.
And that's why the States has the highest cancer rate. I mean, the rate here for
Yeah.
cancer is higher than any other country, the highest,
Yeah.
even in children, childhood cancer. So,
Wow.
yeah. Jillian says, we don't use our wood burning fireplace because of the large particles in the air, just like from fire pits. Yeah.
Yeah. Yeah.
Yeah.
Yeah.
I mean, who knows? All I know is that we have it. We're survivors. And, you know, unfortunately, I had to meet all these wonderful people through lung cancer. But at the same time, I do thank lung cancer because I have a wonderful, huge family, a support group in the lung cancer community. And, because of lung cancer, I met wonderful people. I've traveled a lot. I've done things that I never thought I would ever do. I guess this was my path, but it had to take lung cancer. And, I actually, made me a better person. I mean, what can I say? It's unfortunate, but I kind of do embrace it. And I'm still living,
Absolutely.
and Kim is still living, and all of us are still living, and we do our part to advocate, and we do our part to do what we got to do to be that voice and to bring awareness, and most importantly, to stop that damn stigma because I'm so sick of it.
Exactly.
Yeah.
It's
Um, Andrea said, "Great job, Juanita and Kim. Tell it like it is." I always do. I always do.
it's
And
true.
then
You got to call it, eh?
I know, right? And Lori goes, I want the commercials with the lady with half a jaw to disappear and replace with commercials to tell people to get scanned. Yes, Lori, I
Yes.
agree. I don't
Yes.
know if you guys seen it in Canada. There's a commercial here, and it's talking about, I guess, smoking, and she has half a jaw, and then it says under that she ended up passing away. Am I right, Lori? Did
I
she
think
pass
I've
away?
seen it.
Yeah. You know what? No, we need. You know what we need? We need commercials that shows us. This is lung
Healthy,
cancer.
healthy lung cancer
Healthy,
people, advocating
living.
strong
Yes,
women.
yes, that's what we need. Not, I agree with you, Laura. Every time I see that commercial, it breaks my heart. But at the same time, that's not all lung cancer. This is lung cancer.
Yeah,
Kim is lung cancer. You, Laura, lung cancer. Barbara, that's the commercial
yeah.
they should be showing. You know what? I wonder if I could get a hold of someone to do a commercial and have faces, and all of us say, I have lung cancer. You say, this is the face of lung cancer. Different people showing,
We need a commercial
yes,
like that. We need,
yes, yes, we do. And she goes, okay, hold on, let me go back down. And by the way, don't use those plugs in that give off fragrance. Those are not good either. Throw them out if you have them. Okay, I don't have any, Barb. Thank you, but thanks
yeah,
for the advice. I'm not there yet. I'm glad to meet everyone, and that's the best part of it, but still wish I didn't have it. I know, Lori. I know, but you'll get there, girl. You'll get there. You'll be like me, where like, oh, hey, I have lung cancer, and so what? They
yeah,
don't have them up there. Let's see. Thanks for this. It's so nice to meet real people with lung cancer. You're welcome,
yeah,
Jillian. And if you want to be a guest, hey, just hit me up because I interview anyone that
yeah,
wants to get on here and share their story. It's great. We have to bring awareness and all that stuff. I was in Toronto and they don't have them. The sick packs have graphics pics on them, not the commercials. But hey, we aren't scared. We aren't scary. Okay, I don't know what you're talking about, Lori. Okay, and then Joe has a bunch of you go girl, make that commercial, right, Joe? We need
yeah.
to make that
We
commercial.
need to make that commercial.
We do that. You know what? Let me look into that. After I come back from my vacation, I'm gonna look into that. I want to make those commercials.
Exactly. We
And
want them to see exactly what lung cancer is about, that it's not all,
yes, exactly. This
that
is lung cancer.
we are survivors, and we're thriving,
Exactly.
and we're strong women and strong men, that,
Exactly.
you know,
Exactly.
that there's hope, that, people who have biomarkers are living longer. Like they need to,
Yes,
there's so much that the world needs to know about lung cancer.
exactly.
Canada needs to know about lung cancer,
Exactly.
you know,
Right.
the
Yes. And I,
symptoms.
I am. I'm gonna look into that because I'm tired of seeing, like Lori said, I'm tired of seeing them sick people. No,
Oh
show
yeah.
healthy people.
Yeah,
Show us healthy. And you know what I want to do? I don't know if I wanted it just popped in my mind a while ago, and I was thinking about it, but I have to like either get a hold of longevity or go to foundation or somebody or because it'll be hard for us to do it. I mean, we would have to all like pitch in if we want to, but it's only 12 months in a year. I wanted to do calendars and each month pick like your birthday. So like I'm November, so I get November, sorry. But a picture, a calendar, and maybe people buy these calendars and then it goes towards research, funding for lung
yeah.
cancer. And each month pick someone like their month. So I'm November, so a picture of me and maybe a short little
Survivor
story on the
story.
side, a survivor story. And then like, when's your birthday, Kim? Your birthday,
September.
September. Maybe
I
the
got September. I got
Canadian.
September.
So maybe the Canadians, maybe in Canada, you guys could do a calendar with, I'm pretty sure you have enough to do and then do each month and then raise money for you guys out in Canada. But I would love to do it here in the States. And I was thinking of reaching out to someone either in longevity, but we would have to do it now and or Go To Foundation or even LCFA because I'm under no, Barb,
Yeah.
you're not. Sorry, Barb, you're not gonna throw me off the throne. I'm stingy. I'm selfish. I got November. You could get it the following year. I'm so mean. I love you, Barb. You know I love you.
You'll have a split screen on November or something.
I know we're gonna have to. Um, but yeah, even Lung Cancer Foundations of America, LCFA, reach out to them and
Yeah.
see, and then sell it, and then there's that money for more funding. Um, or we could, all the organizations could do it, and then now, there's so many of us now. We could do, let's say longevity does it, and let's say LCFA. Well, then, if longevity does it, I could give Barb November, and since I'm on the Speakers Bureau for LCFA, then I'll do November for them. You know what I mean? We
Yeah.
could all, yeah, we could all do that. That would be great.
Lung
I
Cancer
can be in the
Canada did
background,
one.
Aloe.
Lung Cancer Canada did do a calendar for the year, and they do have like the Ottawa Circle Group in one, and they have
Oh,
different
okay.
featured survivors in it. But I'm not sure if they did it as a fundraiser or not. I'm not sure if they
Okay.
sold the calendar or if it was just a giveaway that we do at our lung cancer awareness table, because we go once a month to the Ottawa
Okay.
Hospital and we go with all our materials for Lung Cancer Canada, and we try to engage lung
Right.
cancer patients and give them information and show them that, you know, this is really what the face of lung cancer is, that it's
Yeah.
there is hope, right?
Yes.
So,
No, yeah, Janice just put on here, Lung Cancer Canada has a calendar.
yeah,
Janice, do you know, was it free or did people buy it so the money could go towards, lung
it's a
cancer,
Canada.
for Canada? Let me know. It's just a giveaway.
It's a
Okay. It's
giveaway.
just a
Yeah,
giveaway.
yeah,
Okay.
yeah.
Well, yeah. Well, even if we start somewhere, if I could get the chimpanzee sanctuary that I support has one chimp for the big pic and then puts little pics of the other chimps at the bottom of the box that don't have a date. Oh, okay.
Oh,
Okay. Well,
so you could add more
that's,
sisters in,
yeah. Yeah,
and
that sounds
brothers,
good.
and
Yeah,
brothers.
of course. I know, Lori, but the girls, my lung cancer sister Barbara, they all know me. I'm a little stingy, little selfish. They'll- they say I'm bougie ghetto or ghetto bougie, whatever the hell that means. I could be a little ghetto and I could be a little bougie. I want the spotlight on me. I'm just, they know I mess around. Of course, I will put Barb in there with me. Yeah, but that's a great idea, Lori. That's an awesome idea.
My
But mine's
friends,
got to be the.
my friends call me the Sparkle Princess, so
There you go,
so
Sparkle
that's my
Princess.
thing.
I
I'd,
like
I'd
that.
I'd have to have a crown on in it.
Hey, why not? Crown, a sash, everything, girl. Girl, get it all. Sit there. Hey, that would be awesome. Yeah. Uh, but yeah, even if I could bring it up to them, but if that doesn't work, even maybe I could start off here in Northwest Indiana and maybe get someone to sponsor it and pay for the calendars, and then I could grab pictures of everyone that I know
Hmm.
and put it, or even maybe start off in the Chicagoland, and then maybe hopefully it'll go out. You know what I mean?
Yeah, go
It's like
viral.
something.
Yeah, yeah.
Yeah, and so
Or
yeah, so yeah,
just get one foundation to sponsor it, so that then they can
yeah.
distribute it across the country, right?
That's true too. That would be great. That would be
Yeah.
awesome. Now I know that what I'm going to do this year for sure, and I'll just bring it up so maybe you guys, whoever's listening, do it. Um, I know here where I live in Northwest Indiana. So there's a small little city called Whiting that's right next to me. Every October, every October, there's pink ribbons all over that darn city. And I'm thinking, okay, I said, okay, I get it. I get it, but give other cancer, what about pancreatic? What about brain? What about lung? No, it's always pink in October. So I told my husband I wanted to do it last November, but it was so hard because I was planning my trip for my 50th birthday and we were just doing so much stuff. So what I'm gonna do this November for sure is I'm out of my pocket, hopefully maybe I could get some sponsor, but my husband has a friend who has a print shop. So I was gonna make um like flyers or maybe posters, but flyers and put it in all the businesses here. So I live in East Chicago, Indiana. So go to all the businesses and say, here, November is Lung Cancer Awareness Month. Can you please
This
put this
month.
on your window starting November 1st and take it out, after November. But I want this on, and then I'll cruise around, but I wanted to do that last November. I'm doing it for sure this November. And I think, and I know it's money, but if we could find someone to sponsor us or help us or invest or save and pay for it ourselves, if we could all in our little city or town
Yeah.
go to every business and say, here, can you put this? And do a lung cancer like about maybe not a regular sheet, but a little bit longer, where it looks like a flyer, and have the ribbon, and then say something like November is Lung Cancer Awareness Month or something, or something that has to do white out, like let's white out the town because it
Oh,
is,
that's a good idea.
yeah,
Wow.
something like that, and then go to each business and do that. and just bring awareness. Doesn't matter where you live. I think, people will start thinking, oh, okay, okay, okay. Everyone knows East Chicago, where I live. They are gonna know that's for me. But you're like Lori, maybe you could do it where you live. And Kelly's in Seattle. Love the calendar idea. I help with October. All right. All right. Let me look into it. I'm gonna look into it, but wait till I come back from my vacation, because but if we all could do that, save some money and do that, I think that'll be great. So I'm gonna do it in November here. I gotta do something.
Yeah,
I gotta
yeah,
bring more awareness. And maybe you guys could start in Canada as well. Go to
yeah,
your local town,
yeah.
city, I don't know, yeah, and do that. I think that'll be great. That'll be
I'm
great.
thinking, I'm thinking a comedy night or something, or a
Oh, that would
fundraiser. Yeah.
that would be nice. Yes.
I
Yes.
I have a friend who does comedy, so I'm like, whoo, might hit him up for the
There you
fundraiser.
go.
So I'm thinking
Yes,
about
that
it
would be
for November.
awesome.
So
That would be awesome. That would be great. Yeah. And so, yeah, I know that Longevity had a Laugh Out Loud. It was a comedy, and a bunch of us went, and my sister, and my brother-in-law went, and I was hoping they did it again. It was last, I think, May, but this time May came around and nothing happened, and I was upset because, oh my God, that was great. We had a blast. We did. We had a blast. So we took a drive into the city in Chicago, and we had so much fun, but they didn't do it this year. So maybe I need to email them and say, hey, what happened to the Laugh Out Loud comedy show? We did. We
yeah,
had a really good
yeah,
time. Yeah, so that would be great for you guys. Just
yeah.
anything, just to bring.
We're just starting, but we're getting bigger and
Yes,
stronger, and
yes, yes, you are.
our support groups are growing, and we're flourishing, which is
Yeah,
fantastic. And
right.
so,
Yes, yes. So yeah, well, and I know. I think. Hold on. Lori said on October, my oncology office, they have pink gloves, jackets, masks, probably their underwear. And then back in November, they are back to normal.
oh
Oh,
no,
she's so
God.
funny. Oops, hold on. What did I just do here? Okay. And then she goes, and then they're back to normal. It's so frustrating. They only do it for breast cancer. They aren't a breast cancer center. That's
Yeah.
what, well,
It's
Lori, you're bold like me. Bring it up, girl. Tell them, if you do it for
yeah.
October, November, here's white gloves, here's white mask, and put some white underwear too. Shoot.
Yeah.
Shoot. I hate when they do that.
Yeah.
So I'm gonna try and change it here. So if you all guys would do the same, and like I said, maybe get someone to help sponsor and pay for the printing, or maybe ask the printer themselves if they'll donate, and then count how many
Yeah.
businesses there is in your city or town, and say, can I have these many flyers, and then go and put them up. You never know, but we got to do something. So this November, let's do it, guys. I'll pay
Yeah.
for mine. I don't care. If I have to charge it, I'll charge it. But that's what I want to do. I want to
Yeah.
do something like
Yeah.
that.
Yeah.
And the calendar is a great idea. I don't know, that popped in my head, so I got to figure it out how we're going to do this. If we want to give it away, or if we want um, like Longevity or someone, LCFA or someone do it. I don't know. We'll figure it out.
Yeah.
But I do want to do the calendar. I think that'll be great.
Yeah.
Got to start somewhere. Got to bring awareness.
Absolutely.
I'm tired
Absolutely.
of I'm tired of seeing pink. I'm sorry.
Oh,
I want to see
it's
white.
it's so overdone.
Yeah, I'm tired of it. It's our turn now.
It's time for us and other cancers to rise. So, oh,
So Lori goes, when they were taking my blood in Pink Albert, Pink Albert, I asked them if they were wearing white in November, and at they looked at me with a blank look.
oh
Yeah, because they
God.
don't know. So let's start it, Lori. You know what? Get those flyers and go to your center. Says here, November is lung cancer. Put this up so everyone can see, and make sure it's up to the November 30th.
Yeah.
I say, yeah, we got to start. We got to do it. So I think those are great ideas. The calendar, and I think the every November do flyers. And I
Yeah.
think once we do that, it'll get bigger and bigger. But we got to start somewhere.
Yeah.
So just join me in November, and let's get this. Let's get this. We got to do it. At least start in November with the flyers. So if you guys have any other questions, to ask Kim, go ahead, put them in the comments. But Kim, so before we end, share with us, um, what gave you hope back then when you were diagnosed? What gave you hope what gives you hope now? And and do you have any advice that you would like to give the rest of the brothers and sisters that might be struggling or having a hard time, or having some doubt and some fear in them?
I think when I was diagnosed, it was pretty dark days. When you're first diagnosed, you go through some pretty dark days, and you don't have a lot of hope. But for me, I've always been sort of, I've got to find a silver lining. And even though time may be short, because none of us really know,
Right.
how our days are numbered, I've been given a chance to make every moment count, every day count, right? And to just
Right.
go forward with that and make the most of every moment that I have and enjoy every moment. And I always focus on that. That's what gives me hope.
Mm-hmm.
Plus, it's giving me an opportunity to do the advocacy work. Once I can hear the dog. Oh my God. Once I realized, that there's a huge gray area in lung cancer that people don't know about. You start to realize part of this happening to you is everything happens for a reason. So
Yeah.
it's my opportunity to, if I educate, 10 people and it saves someone from getting to stage 4, then I've done what I
Yes.
needed to do. And it's about getting the word out, recognizing the symptoms, advocating for yourself, doing the low dose CTs, looking for the screening programs in Canada are small and piloted now, but hopefully it's going to go globally,
Yes.
mandatory, like your colon, like your
Yes.
mammogram, stuff like that. And I am involved. I did get involved with the Right to Survive campaign, and we did go and speak with politicians on
Good.
Parliament to talk to them about, their campaign, the upcoming campaign, to ask them to infuse more money is specifically directed for lung cancer, right? For lung cancer screening,
Mm-hmm.
for research. And, so if you can just, make that small difference, I think this is my calling, I think this is what
Yes.
happens. Everything happens for a reason, right?
Right. Yes, I totally agree. Well, thank
So,
you for you and the Canadian sisters
yeah,
and brothers there for what you do
yeah.
in Canada. You're making some noise. You're
We're
getting
making some
there.
noise.
So yeah,
Whereas as
yes.
lung cancer strong.
Exactly, exactly. And Lori, yes, my husband's a designer. He's a graphic artist, a graphic art designer. So yes, I'll have him design it, and then I'll put it out there on our groups,
Oh, wow.
and whoever, yeah, and you guys could just use them and then go print them out and post them everywhere.
Oh,
So
that's
yes,
awesome.
yeah. So I'll don't worry, Lori, I'll do that. Just get back with me because I'll forget, girl. So Liam said, before going up to Toronto, I found out the odds of getting lung cancer in Canada are higher than here in the States. Really? Oh, so
Oh,
Lori
wow.
said that, yeah, before she came up to Toronto, that she found out that the odds of getting lung cancer in Canada are higher. Huh. Okay, that's
Wow.
interesting. Yeah, that's
I
very
wonder
interesting.
why.
Yeah,
Hmm.
probably from our pollution is going up there to you guys. I don't know.
It's floating upwards.
Something, right?
You're smoking us out.
I know, right? So.
Yeah.
So, well, thank you, Kim,
Thank
so much.
you.
I truly appreciate it for doing this interview. So just make sure that, after we're done, you can share it.
Yep.
I will put it, if it's okay with you, I do have a YouTube channel, so
Yep.
I got to put, and
Absolutely.
I forgot to put, last week I did Sarah, I forgot to do hers. I've just been so busy. So I got to download them and put it on my YouTube channel, but they're on my YouTube. So if you guys, if you guys know of anyone and they don't have Facebook, send them to my YouTube channel. All the videos are on there of everyone so they can learn
Yeah.
and get educated on lung
Lung
cancer.
cancer.
So again, Kim, thank you so
Thank
much.
you.
I love you. Mwah. And good night, sweetheart.
Good night.
Yes, good night. And then hopefully I will see you soon. And thank you guys for
Thank
watching.
you.
Don't forget to share this video. Okay?
Bye-bye.
All right. Bye,
Bye.
sweetheart. Bye, everyone. Thank you.
Thank
Love you.
you. Bye-bye.